Hello, everyone. Welcome to this webinar about high-level meeting on ending tuberculosis today. I am Diego Mora from Platform, and today we'll be present to webinar about sorry, I have the feedback for the another slide. Today we have the participation of Deliana García and Cedrian Martin. The idea today is talk about the high-level meeting on ending tuberculosis. The last September, the United Nations General Assembly has the first ever high-level meeting on tuberculosis to accelerate efforts in ending TB and reach all affected people with prevention and care. The theme of this meeting is Unite to End Tuberculosis, an urgent global response to a global epidemic. I have the pleasure today for present to Deliana Garcia. Deliana, can you make a short presentation of yourself?
Absolutely. Thank you so much. So I'm Deliana Garcia, and I work with an organization called the Migrant Clinicians Network. And we're a national network of healthcare providers, all of whom care for migrants as their principal patient population. So we've started in the States a little over 30 years ago, because at that time there was a really large population of farm workers who migrated seasonally for employment in agriculture. And over time, those populations changed, but what we really understood is that it was the impact of migration on health that we were most concerned with. So I've been working with them for, like I said, the last 30 years, and I've been working in the area of TB and migration for the last 25.
Thank you so much, Deliana. And now I will take the word for Cedrian. Cedrian, hi, how are you?
I'm great, Diego. My name is Cedrian Martin. I'm the communications advisor for the UNAIDS Latin America and Caribbean Regional Support Team. So I am actually part of a sub-regional team that serves 16 Caribbean countries. And as you know, UNAIDS is committed to the agenda to end AIDS as part of the Sustainable Development Goal agenda. And so we have lots in common with the agenda to end TB in terms of the broader SDG agenda and making linkages. So excited about the conversation today.
Thank you so much, Adrian. Today is a great day for talk about TB. Eliana, you have the first opportunity for tell us.
Okay, I'm going to go ahead and share my screen. It'll take me just a second to pull up my slides. Okay. So please excuse me, but at that point, hopefully I will be able to get us started and we can go. As I was asked to participate in today's webinar, the discussion was really the results and challenges for Latin America and the Caribbean based on what the outcomes were for the high-level meeting at the UN on tuberculosis. And I think the reality of the situation is that the high-level meeting itself was the culmination of one phase of work and then became the marker to start another phase. And so in and of itself, the meeting was mostly a presentation, and I'll talk a little bit about that. It was divided into two sections, which made it really difficult to participate fully in what was going on. On one hand, there was the multi-stakeholder panels, where they had individuals who were from affected communities or from countries where they were having a strong impact in trying to manage TB among their population, or there were, for example, Bill Gates came and spoke at the multi-stakeholders panel. In a completely different room, in a room proximate to where you usually see the UN General Assembly gathering, there was another group, and they participated in an opening and then a plenary and then a closing segment where it was essentially dignitaries who came to speak about what was going on from their perspective in terms of TB and what the result of this high-level meeting would be. Because it was difficult, you couldn't even speak to one another during the day unless it was by telephone, because security was so high. There really wasn't a way to get a full perspective on what had gone on, looking at both sides, because there really just was no communication between the two segments of the meeting. What I think became really clear, I show you this picture because it's me and my boss, Ezra Weste, who's a physician, and he and I have been working on TB among migrants for 25 years together. And so we formed a project called Health Network, which allows people to stay in care as they move from place to place. And our excitement at there being a TB high-level meeting was really, it was so funny to us that we were actually quite giddy about the fact that TB, from our perspective, was finally getting the attention that it deserved, and that certainly what you'll hear now in a number of different venues is a discussion of migrants as one of the key populations. So for us, this was a major celebration, essentially, for all of the years of work in which we'd been engaged. I think it's important to consider that getting to the high-level meeting included a lot of work from a lot of different parties. So what you see here in front of you is a meeting of parliamentarians and speakers and people who provide secretariat support to them ahead of the high-level meeting, because there were parliamentarians came to have site visits with their country's missions, to try and talk to them about asking the ambassadors or the mission staff to really be speaking to the presidents of their countries about the importance of this high-level meeting. And what it points out for me in just looking at this photograph is how well, how rapidly things change in an environment when you're trying to affect policy. For example, on your screen, I'm to the far left. And the gentleman to my immediate left, standing in front of the light blue flag, was a legislator from Mexico. During the last elections, he was not reelected to his post. And so he is no longer in a position to really help with this effort. And yet he was, during his period in Congress, someone who was very outspoken and very supportive and moved us forward a great deal. Additionally, the gentleman, if you look at the far right of the screen, the second from that end, in the hat, came on to take the place of a gentleman who'd been from Bolivia before, but who'd been a member of the opposition party. And so there really was not a lot of hope that a representative from the opposition would be able to influence the president. And so this gentleman stepped in without the benefit of the weeks and weeks before and years before in which we'd been trying to talk to parliamentarians about the urgency of elevating the profile of TB in terms of the health perspective of the country and the budget. And so when we talk about policy implications and the outcomes, this is one of the things for us to consider, is that to truly affect change in most countries at the country level, it is that you have to make sure that there is political will and budget dedication. And most of that comes apart because you can get parliamentarians to act on your part to put that legislation forward to make sure that those two things are in place as you're trying to affect change for TB care. And so I had some of these titled On the Road to the UN High-Level Meeting, because in advance of the high-level meeting, they also had a number of events, and one of them was an interactive civil society hearing where they allowed representatives from all segments of civil society to come forward and have the platform for 5 minutes in different groups, and then allow those from the floor to ask questions and put forward their point. And I think Latin America was really very well represented. Latin America and the Caribbean were very well represented because you had affected populations and folks from representing civil society who were very attentive, who attended all day, who made every effort to put questions forward, who made every effort to make sure that their statements were included in any final document. Because while it would be nice for everyone in the room to have heard our arguments and our statements, what was going to be the most important was that for any statement of urgency from our perspective be included in a written document that then went forward to the different countries as they were considering the statement that was going to come out. And so I was given an opportunity to speak at this interactive hearing. And what was very interesting to me is I had 5 minutes, and I was approached by a physician who felt that we needed to talk about healthcare providers and the fact that they also were an affected community that we needed to be concerned with. I was approached by folks from Latin America who said I really needed to speak to the urgency of care for TB in penitentiaries and among people whose liberty had been eliminated. I was approached by other folks from Latin America to say I needed to speak to the fact that the countries were not registered yet for delaminate and bedaquiline. I was approached by someone else who said that I really needed to speak to the importance of the monies going out on all fronts and the role of civil society just in and of itself. And then I needed to speak about what I'd been invited to address, which was migration and the effect of migration on TB. In 5 minutes, certainly I was able to touch on all those points. And it really brought home for me the item that I was listing before, which is, I'm not sure if anyone was really paying attention to me at that moment because I was the last speaker on the last panel of the day, but at least all of those remarks were captured in an official record. And everyone who had approached me to ask for something specific to be included was pleased that it had happened. And so I think part of what is also our work as representatives of civil society and organizations involved in TB elimination is that we try and represent voices that do not often get put forward, and that when we are given a platform, we really need to maximize the opportunity to affect whatever it is that we can in the brief time we're given. When it got to the high-level meeting, I think Latin America and the Caribbean were also well represented. There were a number of individuals who'd come to be present in the galleries, a little bit set back, certainly from everyone who was on the floor and engaged in the direct elements of the meeting. But they were there. There was a limited opportunity to ask questions or to make statements. And I think individuals tried to take advantage of that as much as they could. But it was really exciting to see the number of individuals who were there representing the Caribbean and Latin America. One of the things that made it, I think, difficult was that there were official representatives, civil society representatives to the delegations, who were able to be included in the delegation itself at the UN when they were participating in this high-level meeting. And so they had separate organizing meetings to try and make sure that everyone understood what needed to go on and how it is that they could sort of maximize their input for the day of the meeting. The problem, I think, is that you had a lot of representatives from civil society who were not able to become part of the official delegation, who were not given access to their country representatives, and yet they were present there at the site, but they were not incorporated in the large group. And so when you have statements being made that the engagement of civil society and affected communities is absolutely essential, and yet the mechanisms for that to go on are really not preserved or really cannot be made as ample as they should be, then I think there's a slight disconnect for the role that continues to be stated is essential for civil society to play when there are not mechanisms to allow them to do that. What was very helpful to us, though, is that we had a number of delegates or representatives who'd been delegates in their country's team for the high-level meetings on HIV. And so we had some individuals then with a lot of experience on what the outcome was likely to be that were able to tell us, we need to understand that once the document goes in, there's really no affecting it. The work that was done on the front end to push it forward was going to mean that whatever we were able to get into the document was going to be what was included. And that really after that, then the work was going to be about using that document in the best way that we could to create the kind of change that we wanted to see. And so what was exciting then is that Latin America was really well represented. I was not as engaged with the representatives from the Caribbean. All of this group was Spanish speaking. And I think that the language differences often do not allow for there to be really great collaboration and integration, because translation services are generally not provided except to Spanish and French. And so while the UN had the capacity to translate everything all day long, out in the other meetings, it's really not the case. But I think what's truly important to recognize is that groups like Stop TB Partnership Certainly we had support from the UNAIDS and other groups, means that we are able to bring representatives forward from the various countries to work collaboratively and to sort of represent our countries and our concerns and our regions on the larger scale, working there together. So I think that we need to be really grateful too for the work that's been done by all of the other organizations in anticipation of the high-level meeting, and then really what's gone on since the high-level meeting. Because I think that that's a critical issue for us to consider, is that while the resolution came out and it was adopted by the General Assembly, and essentially everyone has signed on to it in this current iteration, it really doesn't mean that they are required to take an action, because they can more or less be as responsive to the resolution as the countries can be more or less responsive to the resolution as they would like. And so what's going to make it then a useful element is for those of us who are engaged in advocacy to use the resolution as the basis for our interaction with the different groups that we hope will support our movement forward. And so again, then I want to return to the whole idea of the parliamentarians, of legislative representatives from the various countries. Again, there's some separation by language. So this parliamentary group represents Latin America, and all of the meetings are conducted in Spanish. I guess it would be difficult for there to be a good integration with the rest of the Caribbean if there was not some good language translation. But what it does mean is that, at least from a Latin American perspective, the parliamentarians are truly coming together. They're having strong conversations amongst themselves. They're getting great technical assistance from others. For example, this meeting was held during this year's World Conference as a part of the International Union Against TB and Lung Disease. And at one of these sessions, the parliamentarians received a full workshop for technical assistance on the development of public health law and the inclusion of TB in those laws, and the importance of being very clear about what the outcomes would be so that you were not left with unintended consequences. One of the examples that was put forward came from Peru. In Peru's legislation, they had really asked for people who were in treatment for TB to be given a basket of social supports. And so that became part of the law. But the way the law was written was to say, if you are engaged in a treatment for TB disease following the national norms, then you are eligible for these social supports. What they've been able to essentially do with that law, though, is say, well, then if you're engaged in clinical trials, you are being treated outside of the country norms, and you therefore do not qualify for social support. So I believe that that was an unintended consequence, but that is one of the consequences of what has occurred. And so I do think it's important for us in our regions and in our countries to know who our sympathetic and collaborative legislators are, and really turn to them and work with them to understand what their information needs are, who it is that they turn to and that they trust when they have a question about a health issue, or they have a question about a public health interaction, who they turn to for questions of public health law. And if we are not the person who could be the most responsive to them and offer them the best information, we need to find the person who would be able to do that. And make sure that your legislators in these occasions then has the opportunity to speak to someone who is well informed, who can respond to their questions, who is responsive, and who understands that by virtue of this person's position in their country's legislature, they have the potential to affect public health law. They have the potential to affect budgets, and they have the potential to create additional political will. And so I would say that continuing from the high-level meeting, all of the work that was done preceding that has then gone forward, where there is now a great deal of work being done to coordinate civil society and TB-affected communities so that our advocacy is the most effective it can be. because we understand that we need to be pushing at the global, the national, the regional levels, that there are places where we will have greater success that we can then turn to as examples to other countries to say, our neighboring country has been able to do X, Y, and Z. And there is certainly a great deal of national pride, but also I think a little bit of national competition that could be put to a good end. And it could be helpful for us to then understand that if we work collaboratively and we are learning sort of the promising practices around advocacy from one another, that we could then employ them in our own countries with great success. And so while we were talking then about the challenges and the outcomes from that high-level meeting, I think my takeaway is exactly what I said before, which is it's all of the work that led up to the high-level meeting, all of the relationships that were developed ahead of the high-level meeting, all of the advocacy that was undertaken. The document itself now merely creates a platform from which we can act. It may not have included everything that we wanted to get in a statement from the union, but the resolution at least contains a lot of elements from which we can work in terms of protecting individuals, making sure that they have access to diagnostics and treatment, making sure that care is coupled with social supports, and that there is an eye to the inclusion of civil society and TB-affected communities at the national level as policies are being developed. And so my takeaway message would really be this, that the place for civil society action is amongst their legislators. And it's really understanding who is the sympathetic and supportive legislator in your country, engaging them, making appointments to speak to them as much as you can, and ask the questions that I had said previously. Who is it that you turn to? What are your sources? Can I be one of those sources for you? And if I can't be the source, then I can at least link you to a source of that care so that you are the most effective that you can be. And that's really what I wanted to go over today. Thank you.
Thank you so much, Deliana. For the people watching on YouTube, if you have questions, please throw out to the chat, and in the final of the session, we can ask. Thank you, Deliana, for sharing with us your participation in the high-level meeting on TB. Now, I will say welcome to Cedrian.
Thanks so much, Diego. You know, there are so many parallels between TB and HIV. I think beyond the biomedical response, beyond the programmatic response, the critical thing is that there are certain vulnerable populations that are more affected by both of these conditions. TB is a marker of inequality. It predominantly affects these vulnerable populations. And we're thinking here about the economically disadvantaged. We're thinking about migrants, as Deliana pointed out, people deprived of their liberty, and certainly, of course, people who are living with HIV. And just to emphasize some of the links between HIV and TB, TB is the leading cause of death among people living with HIV. Almost 60% of TB cases associated with HIV are not diagnosed or treated. And of course, we know that if untreated, TB can lead to very quick death. So apart from high mortality, we have very quick mortality among people living with HIV. And people living with HIV are twice as likely to die during TB treatment as those who are not. So there are these very clear links, and that is why UNAIDS is very committed to supporting the outcome of this resolution adopted by the General Assembly and forming linkages where possible. Shortly before the PAHO released a very interesting report about TB in the Americas. And, you know, one of the big takeaways for our region is that we actually have what it takes to end TB. We have the lowest percentage of new TB cases in the world. In the Americas, with fewer than 10 cases per 1,000, 12 of them are actually from the Caribbean. And I just wanted to share this slide. This is from WHO estimates. And since 2000, in the Caribbean, there's been a 56% decrease in TB-related deaths among people living with HIV. So that is just to say that we are doing some things right. We do have some traction, and this is such a wonderful opportunity to accelerate progress. In the AIDS response, we're on the fast track to ending AIDS, and we want to add a TB to that fast track. I wanted to share a bit more of the data with respect to Latin America and the Caribbean, just to note that there are so many variations from one country to the other in terms of joint management of TB and HIV treatment. So some countries are doing it at a very high level and others are not. So just an acknowledgement that, as Deliana pointed out, there are lessons that we can learn from one another with respect to advocacy and also with respect to treatment. And another issue, again here, very huge variations in terms of rates of active TB among people living with HIV who have recently been registered for HIV treatment. So again, very huge variations, and we're cognizant of the countries in which we have particular challenges. So we'll see very high levels in the Caribbean, for example, among Dominica and the Dominican Republic. So we'd just like to emphasize the opportunities for alliances with the AIDS response coming out of this meeting. We need to have an effective and persistent approach with respect to both diseases when we talk about delivering comprehensive services and also developing a strong community response. And Deliana spoke about that extensively. We need to ensure that both responses have the necessary funding, very important, and that they're based on a human rights approach. We are cognizant of the fact that there is a SDG agenda for health. There's a commitment and a drive toward universal health coverage, and we want to ensure that under this umbrella, we have TB, we have HIV, and we also have the non-communicable disease agenda. So really that shift away from silos in terms of advocacy and really thinking about a broad-based agenda that covers all of our health needs. A third priority and an opportunity that we see is ensuring that all users of health services are involved in decision-making with respect to planning and implementation, and that there is a real commitment and move to preserve the trust of communities that are accessing these services. And a final point, and this was particularly a point of advocacy coming from PEPFAR, we need to break with the one patient, two clinics model. And I could say particularly in the Caribbean, where we have seen a lot of progress in the response to TB and HIV, it's because of this move toward more integrated services. Certainly in the AIDS response, we are moving away from treatment in a silo, the standalone HIV clinic, and trying to see how we could come up with a more sustainable model in which we are providing HIV services in a more integrated manner, a more financially sustainable manner. And this is possible. We need government commitment. We need a commitment to promoting local access, and we need joint programming. I wanted to comment on a couple of the issues that Deliana had raised in her presentation. Really, we do need to have that more integrated, strengthened Latin America and Caribbean response. If translation is the only barrier, I think that that is a very low barrier. We can make the commitment to work together as a region, and it's particularly important in the context of the migration challenges that we're experiencing right now. There's such fluidity, there's such movement from one country to another, and so it's more important than ever for us to talk about this at the policy level, at the level of health service delivery, and to ensure that we are protecting ourselves, protecting our populations by protecting the health of all. So we certainly do need to have a more integrated approach, a more a more, I think, a more solidarity. It's great to see that happening at the level of civil society, and it would be excellent for us to support a process of more conversations at the level of governments to improve the response to both diseases. And then, the second critical issue about the importance of civil society, ensuring that we move beyond paying lip service and really bring civil society on. And I think there are important lessons that can be drawn from the AIDS response in terms of ensuring that civil society not only has a say, but also they're empowered to provide services, to provide support. We know that it's not just about pills, it's not just about medical treatment, it is also very much about psychosocial support and all of the care that people need to address not just the illness in isolation, but all of the factors that make them vulnerable to that illness. So I will stop here and welcome any further comments from Deliana and questions.
Thank you so much, Adrian. And thank you, Deliana, too. I have a few questions for you. In first case, for Deliana, you talk about the commitment of the civil society in the high-level meeting, but what happened with the political commitment? Is if you are there, you can see the political commitment for the ending TB, especially for Latin America and the Caribbean.
I mean, I think that what you speak to is absolutely an issue, which is that at the final hour, I know, for example, that our parliamentarian from Uruguay had specifically asked his president to join him there or be there for the high-level meeting, had received that commitment. And then at the 11th hour, something had occurred in country so that the president was not able to attend. But the commitments to be a part of the high-level meeting had come down the communication lines all the way up until sort of the day before. So it really proved for me that all of the efforts that went into trying to convince heads of state to participate were important so that you could talk about the magnitude of the issue and you could speak to the importance of the resolution that was going to emerge, but to understand that on the day of, whatever came out of that particular meeting was going to be just in evidence that day. And then there was going to be the next phase of work, which was to say all of the countries signed on to this. Whether your head of state was present or not, you are now in a position to say, so that the countries have agreed to this. How will it be manifest in our country? So it would have been nicer to see greater representation from heads of state at the meeting itself. It was unfortunate that there wasn't any to speak of, but I feel certain that the work leading up to it and the resolution now in hand give us a chance to redouble our efforts to try and affect, heads of state. I think part of what happened in a lot of Latin America is that there had just recently been elections, or there were going to be elections. And so no one felt like they could take a stand on behalf of the country, because come January and February, they weren't going to be representing the country anymore. And so I think that also limited participation.
Thank you so much, Deliana. And Seriam, you talk about the union of between HIV and TB. Can you make, or what is your how do you say in English? Sorry. What is the opportunity for the civil society for make more strong the participation on TB and not HIV? Because in Latin America and the Caribbean is very strong the participation on HIV, but in TB is more or less, no? I don't know.
Right.
What do you think about that?
I think certainly from the perspective of those civil society organizations involved in the AIDS response, there is a real commitment to break out of the barriers of just talking about HIV, to deal with all of the sustainable development agenda issues. So that means talking as well about non-communicable diseases. It means talking about gender-based violence. So certainly within the community of organizations involved in the AIDS response, there is a move to say, what linkages can we make with other issues, with other platforms? Because we realize that this is essential for our ability to address our particular area of concern in a sustainable manner. And so I think there's an opportunity here for us to say, you know what, we're talking about health, we're talking about human rights more broadly, and to reach a hand out, make that effort to make a connection and to open up the discussion and open up the collaboration.
Good. This question is for good ones to answer. What is the scenario now for Latin America and the Caribbean after the high-level meeting on TB? What happened after?
From my perspective, what happens after is that groups like the Coalition Against TB for Latin America, or TB LAC, the Red TB LAC that's coming out of Peru with some leadership from them, and the Activistas, all need to really have a platform for joint communication so that they can share their strategies. We, for example, through MCN, provide the platform using a Zoom system that we have, so that once a month there are conversations between representatives of civil society in Latin America. Sometimes we have as few as 6 representatives. Sometimes we have as many as 24. It's always very exciting to hear from them what's going on. So that just reinforces for me that it is now time, as we were just hearing from Sidon, to reach out our hands and to try and bring one another into these conversations, both among the individuals who have been working specifically on TB, and again with those who for now decades really have been challenging positions around HIV, and see that there can be a good exchange and a lot to learn. And I think the point that she also made, which is really critical, is Latin America needs to move forward now with pushing. Civil society can really push for the universal health care piece, the universal health coverage, as well as the human rights perspective. And that in both of those, if we have good sound language, sound strategies, and good collaboration, I think we can move this agenda forward.
Fantastic. And just to make one quick comment about government commitment, there is certainly an issue as common administrations go. But, we have seen very strong commitment, for example, from the Caribbean on the non-communicable disease agenda that transcends whether it's opposition or government. So it is possible. And as Deliana said, it is so important to identify those leaders who are willing to advocate among their peers in parliaments and to say, look, this is something we should all be concerned about, regardless of our differences. This is something we can all agree on. So it's just about us refining the advocacy strategies that would help us to get to that place where it doesn't matter who is in power and when, but we do have that firm shared agenda.
Exactly. So that we create continuity in the message and in the effort. And I think civil society is the critical element there. Because even as, governments come and go, the population remains. And if those strategies are in place and that commitment on their part is also in place, then the government can change and those people just step back in and create those links once more.
Thank you so much. Now, for the finish, maybe you have a conclusion about the webinar of the high-level meeting for sharing with us.
Golly. I think it was very interesting for me to speak to one of my colleagues from Eastern Europe, because I think there was a good deal of disappointment with the content of the resolution, that very specific elements were not present, that language was stripped out by some of the countries, that some of the topics that different groups felt urgently were essential to include were not included. And so that what it resulted then was a general disgruntlement with the resolution, and it didn't have this and it didn't have that and it lacked the other. And he stopped me in our conversation and he said, people can be really unhappy. Absolutely. We could always want more. But now we have this. And what we have in hand then is the ability to say, your country, this country signed on to it. Tell me how you're going to make it happen. Not that we're creating it from I think the country ought to do this. It's my position that the country should be taking this on, but rather the country made this commitment. I think that is a fabulous piece for us to work with.
Absolutely. Absolutely. I'd like to echo that. And just to mention, we go through the same experience with our high-level meetings for AIDS. There's always a group of people who think, I wish it went further. I wish we had this specific language. That always happens. But what's important is that there is this commitment by the community of nations, and it is a starting point to really accelerate and move forward. So I look forward to further collaboration with civil society, further collaboration with our governments to move the agenda forward for both ending TB and ending AIDS.
Thank you so much, Serian and Deliana, for joining us today. We are very happy for your participation in this webinar. And I want to invite to the people for follow us in Twitter and Facebook LAC platform, and in the community, the new platform for know about HIV and TB in Latin America and the Caribbean. Thank you so much, Deliana, Serian. And if you have something for share us, is the moment.
Okay, thank you so much.
Goodbye, and I'll see you in another opportunity.
All right, thank you. Bye-bye.
Bye.
Thank you.